Welcome to Imperfect Heart, a place for you to join me, Jeff Holden, in conversations, discussions, and dialogue about our hearts and the impact myocardial bridges have on them. We'll talk with healthcare professionals, those in related fields that support our condition, and others just like us with stories of their myocardial bridge experiences. It's my intention for this content to inform, educate, entertain, and even motivate or inspire you in your personal journey on dealing with a myocardial bridge. Most importantly is to have you leave each episode with hope, knowing you're not alone and that what you're experiencing is real. My guest this episode has been somebody I've been talking with for nearly a year now. We've developed a very appreciative relationship, and what you're about to hear not only in his story, but in the subsequent two stories, comes as a result of his intent to be sure our stories are getting told and that doctors and the medical community are listening. This is the first of a three-part series that will have you hear David Vollmer, first, share his journey and outcome post-robotic surgery. You're then going to hear from Dr. Jeffrey Fowler, the interventional cardiologist that did the provocative testing for David's myocardial bridge. This will be the first time we've ever had an interventional cardiologist walk us through the provocative testing process. Then, third in the series is going to be Dr. Johannes O. Bonatti, one of the top robotic cardiac surgeons in the country. He's going to walk us through the process of operating on David's heart in detail. So, you see, David's been instrumental in documenting his journey all the way through to completion, and he's even been able to get his surgical team to agree to the podcast once he was repaired. He's a father of three wonderful young men. He's been married for 21 years to a most supportive wife, has a master's degree in biology, which you'll certainly appreciate when you hear his personal approach to well-being. He served as a crew chief on a Cobra helicopter in the military, and he has successfully built and sold a fitness product company that has enabled him to now semi-retire into a consultant on systems and process for businesses looking to grow from 6 to 7 figures. David Vollmer, welcome to Imperfect Heart.
Yeah, it's great to be here, Jeff.
You know, it seems like I've known you for years, but it's only been a little over 9 months since we first connected. And that came as a result of you wanting to talk about your story and say, hey, I think this journey is going to be important, and I want to get in front of it. I said, of course. I mean, nobody gets this far in front of it. But now that I've gotten to know you, I certainly understand how this all came to be. So you're a pro supplement guy. You're really focused on organics and holistic measures for health, plant-based solutions versus pharma. You know, let's start with where you first noticed something wasn't right and what you started to do about it.
Okay. Yeah. So the big impact date was December 11th of 2023. I got AFIB while I was working out with a friend, and I was on a stair stepper. I was like, man, I just didn't feel good. I felt off. I just, something was wrong. And I didn't have an Apple Watch or anything at that time. So he's like, here, put my Apple Watch on. Let's see what your heart rate is. And it was 140 something. And it was said I was in AFib. So I was like, oh God, I was scared. I come up, cause my gym's in my garage. So I come up, got my wife. She took me to the hospital, went in the emergency room. By the time I got in on the bed, I was out AFib. And they were like, oh, there's nothing wrong with you. So I was like, okay, maybe this is a one-off thing, but I started, they explained to me what AFib was. And then I started, just doing some research. They said I should follow up with a cardiologist. And so I did that the next week and went in and saw him, from that time to the next week, no episodes of AFib. And, I work out almost every day, either doing some cardio or heavy lifting. So this was very abnormal for me to see this in me, because we eat well, we do all those things. So on December 14th, I had that meeting with that cardiologist, and he said, hey, let's just get you some testing. And, with my background, I love testing. Test. And then you figure out, what you need instead of just winging it. So I was all for the test. So he ordered me a stress test and an echocardiogram, and that was going to be on January 18th. So more than a month out. So I was a little upset about that, but I guess that's just how it goes, you know?
Did you have any other occurrences of AFib in that period of time?
Yeah. So on December 26th, the day after Christmas, I had AFib, went to the hospital. They checked my heart rate and they said it was at 126, but then they told me it was going to be 13 hours before I got to bed. So they just said, you'll be fine. Just go home. So I went home, and then I had one more episode on December 28th and went back to the cardiologist because they said, come on in the office. So they put me on the bed. They put the EKG on me. And literally, as I was getting the EKG put on me, they could see I was in AFib, and then I went right out of AFib. It was like immediate that we went out of AFib. So the cardiologist there said to me, here, take these 3 medications and schedule yourself an ablation. And I was like, what? You know, it was mind blowing to me. Like this is like the 3rd time that I've had AFib. They've all been short episodes, but why would we want to, you know, schedule an ablation surgery? I mean, that's a pretty big deal.
Right.
When I only had symptoms for not even a month, I read the book on how to cure AFib. So got that book, and it said, you know, check your magnesium levels, your potassium levels, both whole blood and intercellular, check your selenium, you know, a bunch of different things. And I said, hey, I want these 7 tests. Can you write me an order so we can test these things? And she wouldn't do it. So that was really frustrating for me, you know, dealing with them on that aspect, because my insurance was going to pay for it. All I needed was the doctor to do it. And if she didn't do it, which she didn't do it, I ended up doing it myself through like direct labs, just ordered the blood test myself and did the blood testing, and demanded that I could see an electrophysiologist because I wanted someone that could work with me. I even spoke to the staff and said, listen, I don't want to take medications if I don't have to. I want to find the root cause, and I want to really understand what this whole thing is. And they said, okay, yeah, this guy, you know, he seems to fit with you, you know, we'll schedule you. But that was February 5th.
And we also know that for the most part, AFib is a condition that's an electrical issue in the heart rhythm.
Right. Right. So I went, and then on January 10th, I did a lot of work that day, worked like 16 hours, and I got dehydrated. So on January 11th, I went into AFib again. And then my wife posted on a functional medicine website for her thyroid and said, hey, this is my husband's symptoms. This is some of the blood work that we had. What do you guys think? And one of the doctors said, hey, I think he's low in probably potassium and magnesium. Just tell him to, you know, up his dosage and see what happens. And that was at 4:00. She told me the answer. And so I went and took 2,000 milligrams of potassium and some magnesium. And 25 minutes later, I was out of AFib. And that's what it was. I got my blood work back 2 days later that I took the week before, and it showed that I was deficient in potassium intracellularly and in whole blood, and I was low in magnesium. So, and I did a hair test to confirm. And so since that day, I really watch my electrolytes, and that, you know, brought us, you know, I didn't have any more episodes of AFib until recently, but that's a new part of the story. But so I had the stress test done and the echocardiogram, and they both showed ischemia in my heart.
Interesting.
So I maxed out the stress test. You know, I got to 173 beats per minute. I was breathing pretty heavy. And, you know, at this point, I didn't know anything about you or bridges or anything to that nature. So I was just thinking, okay, I have ischemia. And then that was January 18th. And then on the echocardiogram, they said, you have Wilkinson-Parks White syndrome. And like, they literally called me. I was reading the report, and a nurse called me and said, oh my God, you got to get in here. You're going to die. And I'm like, why? She goes, well, you have this WPW. And I looked at, I was already looking into it, what it was. And that's when your heart races over 230 beats per minute. And it has other things, which I was exhibiting no symptoms, never had any symptoms of any of this. And here the radiologist read it wrong. as I come to find out after I met with the electrophysiologist
Mhm.
on February 5th. Um,
Nonetheless, that's a little frightening because now
oh yeah,
you're told something almost contrary to what you assumed or believed, especially since you were getting better.
right, right. So, but then I saw the ischemia and I'm like, well, what's this? So I didn't understand that. So I started reading up on it. And then on February 5th, went in and saw the EP, and he's like, and I brought all my notes with me. I brought all my blood work with me, and I had on top of my binder the book How to Cure AFib. And he walks in and he looks at me and he looks down and he's like, "How to Cure AFib, huh?" And I said, "Yes, sir." And he's like, "What quacks wrote that book?" And I was like, "It's two of your colleagues." I said, "One runs the cardiology division at a hospital in Utah, and the other one's the head of the cardiology department at the University of Utah." And then he was like, "Well, what did they say?" And I said, "Well, they said to check intracellular potassium, magnesium, and sodium." And he was like, "Oh, yeah, we don't do that." And I was like, "You don't? Why wouldn't you do that?" "Well, that's not standard of care. Standard of care is to check whole blood only, not intracellular." And he says, "Well, how are you feeling?" And I said, "Good." I said, "I've fixed my potassium levels. Here was my results." I showed him everything. And I said, "But in this one echocardiogram, it says I have WPW." And he was like, "No, no, no, they read it wrong. It was, he goes, "You're perfectly fine." He goes, "But you have ischemia." He goes, "You have a clogged artery." I said, "I don't think so. Because of the way I eat, I take high dosages of K2 and been doing that for 10 years to preclude any calcium buildup in my arteries." He's like, "No, no, I'm going to bet you have a big blockage and that's what's happening." I said, "Okay." I said, "How do we fix that? Or how do we see what that is?" And he says, "Well, we'll get you a calcium score." I said, "Okay, I don't know what that is, but sounds like a plan." So I booked it myself. And then that went, I believe that was April 4th, went and did that CTA. And took about 15 minutes. Wasn't, I had no idea what to expect.
And
You know,
for the benefit of somebody who's new to the program, a couple acronyms you use. PCP is your primary care physician,
yes,
but the CTA that you're referring to is a CT angiogram, which
correct.
coincidentally, early on for you, most people don't get their CT angiogram until deeper into the process. You're fortunate that they started there. It's the gold standard for identifying a bridge.
Yeah. And that's what I found out after this.
Yeah.
And so I was walking out of the hospital and they literally got the results right away. So my primary care physician called me and he's like, "You lucky bastard." And I was like, "What?" He goes, "You have a calcium score of 0." I said, "Well, what does that mean?" He says, "You don't have any plaque. Like you have 0 plaque." And I said, "Well, what does the CTA say?" He goes, "Well, you have no signs of atherosclerosis. You have no blockages, but you have a myocardial bridge." And I said, "Well, what's that?" He goes, "I don't know. I looked in the literature real quick. They look like they're benign. So I don't really don't know." I said, "Okay." So I had a 40-minute drive home. So I'm telling my wife this, like, "Hey, they found this myocardial bridge. Start looking up." And she's like, "You just look it up when you get home." So soon as I got home, I've been listening to podcasts for a while on health and fitness and stuff. And I just typed in myocardial bridge in my Apple podcast. And there you guys were, my imperfect heart. So it was like, wow, like this is a big deal. Like there's a podcast specifically on myocardial bridges. This must be bigger than what everybody thinks. So over the
It
period of that
it
week,
is bigger than everybody thinks, but not everybody knows.
right? It was completely by accident. Like this is how it happened. So I listened to every single one of your episodes that you had on there during the next week. And I was like, "Oh my God, like this is bigger than anything." And I even called my PCP. I was like, "Yo, dude, like people are having heart attacks from this. People are dying from this. People are having all kinds of other problems." And then I also then reflected back and said, "Wait a second. When I was 4 years old playing T-ball, my chest hurt when I ran around the bases. In my chest, I always had chest pain, always. And I just thought it was normal. I thought everyone had chest pain, but after hearing, all the stories and everyone talking and your story, like this is what I've had my whole life, and I never knew it. And then also reflecting back when I was in the military, I maxed out the PT on sit-ups and push-ups, but when it came to the run, after I ran a mile, I would just die, completely. I couldn't catch my breath, and they would always bust my balls and, tell me that I'm not in shape enough, and I would run every day, twice a day, trying to help, and I could never get that long-term endurance. And as we go further into this, we find out why. But the knowledge that I got from my imperfect heart set me down the path. Like, okay, I got to get this looked at. I got to do an invasive cath to see if this is really the issue. But then after hearing, is it Kofidis?
Cofidis.
Kofidis, yeah, from Greece. So I actually reached out to him right away. He did a consult with me, told me, that he does minimal invasive, and that, make sure if I don't go with him, if I go with someone else, make sure they stop the heart, because unless they have a stabilizing arm, they can't operate on a beating heart. And he's like, you want to look at minimal invasive. So I thought that was really great. I was very grateful to him for the fact that, he wanted the business, but even if I didn't do the business with him, he was giving me the right direction on how to look into this. So then I went on your site and pulled up all the doctors, and I called Stanford, I called the Mayo Clinic, the Cleveland Clinic, every person on there I reached out to. And I was like, okay, I got to figure out who I want to go see, what the benefits and disadvantages are of each. And then I narrowed it down to 3. In Greece, Dr. Guy, because I heard him on your event. He was an Army guy, so I like that. And then Dr. Bonatti, which I didn't hear anything of, but he was listed on there that he was over in Pittsburgh, and that was about 5 hours from me.
And he was one of the doctors that I had slated to talk with,
Right.
because there's only a handful of guys doing robotic surgery in the country in any volume. And
Correct.
Dr. Bonatti was the only one I hadn't spoken to yet, so he was high on my list. I
Right.
want to step back just for a second, because you're very research oriented. And to
Yes.
your credit, you dug deep into a variety of different things. You tried a variety of different supplements as you're going through this whole process. You actually have a hyperbaric chamber in your basement, which is very unusual, as
Right.
well as a red light booth.
Correct. Yeah. On January 8 or January 31st, my wife was diagnosed with breast cancer.
Mhm.
And so on December 11th, though, we made the decision after I got the AFIB, like, we got to start investing more into our health. So I found a red light bed on Facebook Marketplace. I found a PEMF mat, so we got some of these things. And that's actually how my wife found her tumor, was laying in the light bed. But then after she was diagnosed, then we went a step further and got the hyperbaric and a couple other machines just to help her with that situation. And she's doing great now.
Good, thank you. I was going to ask. So
Yeah,
you're doing all this, yet these symptoms still present. So you're
correct.
recognizing maybe this is something more than I can control. Maybe there is a mechanical issue. Now you're going down the path of exploring doctors to rectify the condition that you've got.
Right.
And you talk to Dr. Guy, to Dr. Kofidis, and eventually to Dr. Bonatti. What was it that brought you to Bonatti as you go through the process?
The reason why is because it was in Pittsburgh, it was in Pennsylvania, and I'm in Pennsylvania. I really wanted to go to Greece. That was my number one choice for a long time through this process, or for a month through this process. But my wife came to me and said, listen, if we go to Greece and you die, how am I going to get you home? So that was a legitimate, concern. And, like, all my kids and stuff, like, how are they going to deal with this if I'm out of the country? And then she didn't have any support structure if we went out of the country, where if in Pittsburgh, I have family within an hour of Pittsburgh and stuff like that. And then I also liked Dr. Bonatti and I blended better. Dr. Guy and I, we hit it off well. Dr. Henry and I, we weren't on the same page. And it's not, he wasn't bad or anything. It's just, I found if you find people that are in alignment with you and they just fit and you just know it right away. And I'll give you the example with Dr. Henry, explained my situation. And I don't know if he downplayed it a little bit for me
And,
to say, hey, we got to do an invasive cath, and then we'll see what goes on. And, it's probably not um, uh, symptomatic. He goes, that's what we normally see. Most aren't symptomatic. And I was like, okay, where Dr. Fowler, he presented a different aspect. He asked me what I wanted to see done. So I said, well, I want to use the Stanford protocol. And he's like, okay, I'm not really familiar. Then I pulled up your website during our Zoom call and he dove into it. And he's like, oh, wow, these really make sense. And we just clicked a little better. And, everybody clicks with everybody a little bit differently. And that's the reason. And then Dr. Bonatti, the way he explained the surgery to me, he's done over, 4,900 robotic surgeries and he taught Dr. Guy. So, I was like, oh, wow. And it's closer.
yes.
Because, looking into just the travel into Georgia to have it done, we would have to go down 3 or 4 times, spend a lot of hotels, no family in the area. So a lot of these things tied into why we picked Pittsburgh, because it came down to my wife and I, discussing it.
Yeah. And you mentioned a couple of different names. Let me go back just for the benefit of the listener. Dr. Henry is the interventional cardiologist for Dr. Guy. He does the provocative test, the invasive catheterization that you mentioned, which is the provocative test to identify the depth and the symptoms and the specifics of the bridge and how it's functioning and what it's causing in the sequence of its process of blood flow. And then Dr. Fowler is the interventional cardiologist for Dr. Bonatti.
Correct.
They both work in tandem. And just as sequentially explaining that, Dr. Tremmel at Stanford is the same to Dr. Boyd. So she provides all the provocative catheterization and testing for Dr. Boyd in terms of their protocol. And then the Stanford protocol is one now that is being accepted as the best practice to identify all the elements that the surgeon needs to understand and to really identify the significance of the bridge. Because there's a certain threshold that they're going to say, you know what, we might be able to treat this medically. We don't really want to cut you and go into such an invasive situation, even robotically. It's still heart surgery.
Oh,
Yeah,
yeah.
the body isn't getting opened up as much, but you're still operating on the heart. So we don't want to dismiss the significance of this procedure in any way, shape, or form. Okay, so now we're caught up.
Yeah.
You've
So just wanted to add in too that I did talk to Stanford. I did talk to the Mayo Clinic, the Cleveland Clinic, and they all wanted to treat me with drugs first. And I'm, personally, I'm anti-drug if it's a mechanical problem. So that's why it was really important to me to get this invasive cath to see if it was symptomatic because it was a structural thing. Because I don't want to take any pharmaceuticals if I don't need to, where it's a mechanical problem.
Mhm.
So, and that's why. And since they were close, we decided to go forth with the invasive cath, and that that happened to be on June 25th of this year.
And we know from the discussions that you had with them, it really was a comfort level, and they were receptive to what you're asking, which I will say, based on what I know about you, you're very, very thorough. You're very deep in your investigative process. You understand a lot of what's going on, and you're probably talking in some cases in medical terms that are at their level, as way above the layperson. Certainly, even my level, understanding it, yes, but conversant, not at all. So you're a bit of a different animal coming in there because you're
Right.
asking questions to a different degree. And I think that's important as well, because some doctors will dismiss that. They don't necessarily, they're not comfortable with it. These guys, both Dr. Bonatti and Dr. Fowler, were really receptive to what you were talking about.
Yeah, very receptive. Because the other thing is that I did a little bit differently is is I'm unvaccinated. So I wanted to use my own blood and my wife's blood or my kids' blood because they're all same blood type. And Dr. Benatti's team made it super easy, and UPMC made it super easy for me to be able to, get the blood there, to have it organized, to have it ready. Where a lot of the other hospitals said that we just don't have that policy. We can't accommodate you for that particular thing because we don't have a system in place to do that.
Hmm.
So that was another win in our check boxes. They were going to do it in Greece and they could do it in Georgia too, but it was a little more in depth of how we had to do things, and we would have to go to Greece a month early, donate, and because they couldn't ship it over, so we would have to do everything there, and it was just much more complicated and convoluted. So we're really shortening the amount of energy that I put into this. Like this was my focus every day, in researching and understanding, because I really didn't want to get cut either. I was really nervous and afraid, and I even sent you a message one time like, "Hey,
I know.
is this really the right thing?" Uh, so, but going into that heart catheterization, I was pretty nervous too. I read a lot of horror stories and different things, but when I got there, Dr. Fowler came into the room. He talked to me for about 20 minutes prior to the surgery, and we talked about the program, what we were going to do, what he was looking to find, and what would be positive, what would be negative, all these things. And as I go into the operating room, they slide me on the table, and then he's like, "Oh, Dave, we're changing it up. We're doing acetylcholine now first instead of last." And I'm like, "Why would you do that? Like this was the protocol." He's like, "Oh, I just talked to Dr. Shaw, and he advised me that this is better to do it this way." And I was like, "Wow,
Yeah.
this is really cool."
And I'm gonna stop you for a second there too, for the benefit of somebody who hasn't listened to some depth of the episodes. Dr. Samit Shah is at Yale University, incredible cardiologist, and he's doing a clinical trial on Inoka, which myocardial bridges fall into, and that's presentation of ischemia without any apparent blockages. Just a wonderful doctor, extremely receptive, and he's also trying to establish the Stanford protocol as the protocol for testing for myocardial bridges with the catheterization. And he's got a handful of hospitals around the country who are now participating in that clinical trial. So that's Dr. Samit Shah, who your Dr. Fowler, interventional cardiologist, reached out to and immediately got a response. So these guys are all communicating to our benefit, which is just so cool.
Yeah, I never thought in a million years that would happen, but that just shows me that there's a lot of doctors in this group that are really conversating with each other, finding out what's working, what's not working, what's best practices, and that really put me at ease going on the table. Because now there was another doctor, which I heard the episode with Dr. Shaw, and I was like, "Oh man, this is like having all the elites in the room at one time, conversating."
Yes, yes. So you make your decision. Now you're moving forward. You get your provocative test, and what's the result, and what do you do like almost immediately, if I'm not mistaken?
Yes. So as I was laying on the table, he kept me awake during the entire procedure. And he said, "Okay, we'll give you the acetylcholine." And he found a little bit of endothelial dysfunction. And then he did the demutamine challenge, which raised my heart rate. And we saw that we had a significant flow difference between the top of my LAD and below the bridge, that it was blocking. And we only got to 130 beats per minute. And he said, we don't need to take you any further. This is significant. And the only thing that will fix this is an unroofing. That's clear as a clear picture.
Mm-hmm. And
So
I want to add too, at this point, this is a 3-part series. We're just now talking about this Dr. Fowler guy who turns out to be your interventional cardiologist, who's doing an extremely thorough job, an appropriate way of testing for the bridge. Dr. Fowler will be the next episode following yours, where it'll be the first time we've had this discussion of the provocative test that we hear so much about, and he's going to walk us through it. some of the details that you're speaking of. He'll give us a better understanding of what the significance is and what that means and why they do what they do. But for the benefit of this discussion, I just wanted people to know that we are going to have a very in-depth conversation with Dr. Fowler in the next episode following yours.
Yeah, he'll be able to explain it so much better and so much more in depth because it was really neat to see. And I couldn't believe that he kept me awake for it. And he also had other, interns and fellowship people in there because it was one of the first times they were doing these provocative tests on a symptomatic bridge patient. They haven't seen that like the way they did it this time. So it was kind of neat, but it was kind of weird seeing all these other people in the room watching it be done.
Yeah.
But he came to me after the procedure, explained to me everything again, because now I was, fully awake, and, said, listen, you got to talk to Dr. Bonatti. You need to schedule this unroofing because that is the only thing that we can see that will help your condition specifically.
And if I'm not mistaken, you saw Bonatti and you said, okay, let's go.
Yep. Yeah. It was, he could have got me in a little bit earlier, but my wife and I, we go to Bike Week in Ocean City, Maryland, with friends every year. So we scheduled it on September 18th. So that way there, I could make sure, we went on our vacation and, then went out to Pittsburgh, and it was really nice in Pittsburgh. They have it's called the Family House. It's kind of like a Ronald McDonald House for people going to UPMC, and you can stay there. It's $99 a night or so. And, that's where Paige stayed every night when I was in the hospital. It was close. They have a shuttle. They made it really convenient. That was one of the other big benefits is we could park the car and we didn't need to get it until I left.
Mm-hmm.
And it's just all of these little things made this decision the right one for us because the convenience and everything like that put together just made it so smooth, especially on my wife, because this was hard on her too, seeing me laid up, and not being able to hardly move at first, things like that. Cause it was pretty intense. As I went for that morning, I ended up, getting the nerve block. Some people get it, some people don't. They say that it probably helped me with pain, through the thing. But, I went in the operating room. They showed me the robot. I was like, wow, this looks pretty cool. And Dr. Bonatti will, talk a lot about that. Then they gave me a little bit of stuff and boom, next thing I woke up, in the ICU. It was about a 5 or 6 hour. I was in the operating room.
And you mentioned Dr. Bonatti now as you go through the robotic process. Following Dr. Fowler's episode, we're going to have Dr. Bonatti on to talk about the procedure with you and for the benefit of the audience.
Yeah, and he has video.
And he's going to have some video, yes. So you've had your surgery, you had the robotic process, you're now in recovery. What's the experience? What are you feeling?
So as of today, I feel amazing. The process afterwards was a lot harder than I anticipated. Because I read a lot of things with robotic. Oh, it's easy. You recover fast, and coming into the surgery, I was working out every day. I was pushing myself, really hard to be in the best physical shape of my life prior to surgery. And what happened in the hospital is I got a little bit too much fluids, went into AFIB on the second day. And then, afterwards, once I was discharged, I did blood testing every week I've been doing, and I'm still low in potassium intracellularly. So I had a really tough time with AFib and aflutter after the fact.
No pericarditis though, correct?
No pericarditis. Okay. No. So, just with the inflammation of the heart and with the stress, of everything and being over fluid and not eating at the hospital, because to be honest, I couldn't eat the hospital food either. It was, really bad for you. I can't believe that they feed heart patients some of this food. But it was, I took pain pills for the first week So it wasn't the pain. It was just, I guess the other thing is I'm a very high performer and I'm always moving, always on the go. And for me to sit still, it was a big mental challenge. Not as much physically, but more mentally. Um, but now going through that process, I'm 2 months out post-op, and like the last couple days, I've been feeling amazing. Like,
And I do want to address, because we talked about this AFib situation. You've been going back and forth. You've been getting your blood tested more than the average bear. Most people aren't going to be as aware and wanting to understand everything about what's happening. Your potassium, your sodium, your magnesium, all your levels, both intracellularly, which
yeah,
I'm not even familiar with those tests, but you're really digging deep into it, and you're actually still working with both Dr. Fowler and Bonatti in the process of what you're doing and sharing it. And
yes.
if I'm not mistaken, you actually found an herbal result that worked to help with the AFib.
Yeah. So it's called Wexin, Wenxin granules. It's from China. They've been using it for over 5,000 years as an antiarrhythmic herb. It's 5 different herbs that are in. I can't even pronounce them, so I'm not going to
Yeah.
try. Um, but I read a lot of research, and I actually I sent Dr. Fowler 9 research papers of peer-reviewed studies where they use this herb in conjunction, say with amiodarone or metoprolol, to really suppress AFib. And once I was out of A flutter, I got an A flutter and I was in it for about 3 weeks. I tried the herb and it didn't work. But I had a cardioversion that shocked me out of it about a week and a half ago. And then when I had the AFib episode here, I drank it within 10 minutes. I was out of AFib,
Mhm.
and it's definitely been working well. I've been drinking it every day just to help suppress the symptoms. I'm still looking for the root cause, and it may be I may have an adrenal gland or a pituitary problem or something's out of balance still, but it's getting better. But like I blood test every week. Like we're doing full panels on me every week of everything from cholesterols to testosterone to DHEA. So I really want to dive deep, and it's nice because I have a PCP, the primary care physician, who's local, and he's a functional guy, so he's all into this. And then I told Dr. Bonatti and Dr. Fowler, and they're like, "Oh, we want to see the results because no one does this." Uh, so it's kind of neat sharing because they may be able to help other people going forward. Like, hey, if you have these things, you could do these particular tests and see if this could help you.
Exactly, and that's why I wanted you to share that. I will put the caveat in there that you are you, and the situation for you is different than it will be for anybody else. But to know that there are options and places to go and things to look at and alternatives to something you may be uncomfortable with. Whether or not they work, we don't know because everybody's individual. You all have unique chemistry and capacity and
Correct.
and depth of research and knowledge, of which you've done a great deal. So I don't want this to be misconstrued as medical advice, but if you're listening to what David is saying, the way he's done this, I mean, here's somebody that's doing blood tests every week. Here's somebody who's really gone deep in terms of their knowledge and probably smoked his keys for Google search and YouTube search just on every little facet of the condition, and then the side effects of the condition, and going down some pretty deep rabbit holes. So if you're not in that space, then maybe this isn't for you. But for somebody who is, who really wants to look at it from a holistic perspective, there are some things you can do. And that's not to say that the mechanical thing doesn't get fixed. There's a mechanical issue. If it needs to be fixed, it needs to be fixed.
Right.
There's no amount of herb or supplement that's going to fix a broken wheel, so to speak. But post that, or for mild symptoms, maybe there are options, and you must work with some semblance of the medical community, whether it's your primary care physician or your cardiologist. Those are really important. Don't try to do this on your own and think you're going to solve something, because you may make yourself worse.
Yeah, yeah, you got to be really careful. And that's where I'm very fortunate to have a PCP who's so close to me. And he's using me as a case study basically for his other people because I'm willing to take, on risk, because I'm a risk taker. But we're basing things off of science, and every vitamin, every mineral that I take is 100% based upon either hair test or blood test. So I don't supplement just for the sake of supplementing. I'm supplementing where I need, and I have deficiencies where I can't get it from my own, the food. And being all organic, and I eat no processed food. I haven't eaten McDonald's in 25 years. So all of these things also play a massive role in recovery and longevity of, functionality of whether it's AFib or anything outside the mechanical problem with the bridge. Because, you have to take care of yourself. If you have diabetes and you're overweight and you eat processed foods, you are going to have problems that are going to accompany the bridge. Because like in your show, all the people, or a majority of the people, were like athletes, like high performing athletes, and they're watching what they eat and doing this. So if you don't do all those things and eat well, you cannot outperform a bad diet. You can't outpill it either. It will come up and catch you. So if you're going into this, get yourself in really good shape, or better shape than you are in now before a surgery or things. And then look at how do you minimize inflammation, because now, 2 months post-op, like I feel like I could run, a 50K now. Like I feel I don't get winded anymore. It's so strange. That's something that I felt my whole life. As my heart rate increased, I would get winded. And now my heart rate goes to, I had it up to 150 yesterday on purpose. And I didn't have any of that feeling. It was really cool knowing that blockage there, that squeezing isn't there anymore.
Mm-hmm. And that's what I was hoping you would get to. If you didn't, I was going to ask you now, just 2 months out, 8 weeks, you feel better. You recognize that something's changed from what you were dealing with historically and previously. Your symptoms post-surgery have been relatively mild. I mean, the AFib is a concern, but
Right.
for the most part, it looks like you've got it under control. And if not, that's a very familiar situation to the doctor. It's
Right.
not as aberrant and unfamiliar as a myocardial bridge is. So, to that extent, it's just wonderful to hear that today you can say with confidence that you recognize the difference of the surgical process.
Oh yeah. Unbelievable.
Yeah.
And the other thing is, for everybody that's listening, you have to advocate for yourself. Never take no. And that's why I called every doctor, because I wanted to hear what every place would say, what Stanford would say, Mayo Clinic, Cleveland Clinic, places in New York, like all these places. I listen to what they say, and you can always get some good advice, even in a conversation. Yeah, it costs some money to do that, to have all of these meetings and things like that. But this is your life you're talking about. This is, the rest of your life. If you space it out, over the next 40, 50 years that you'll be alive, it's really minimal. It's a few $100s that you have to invest in yourself to be able to move forward. And even dealing with a local cardiologist here, when I went to get my cardioversion, he wrote down that I had a bypass surgery. And that's what it said on my notes. And I'm like, no, I had a call and they're going through all kinds of process to switch it. But I'm like, I didn't have bypass. I had an unroofing. And they're like, what's that? Like a lot of the community doesn't even know inside the cardiology departments. They don't know what a bridge is. They don't know how it functions. They don't know what an unroofing is. They were all very surprised locally here, but that's why I still deal with Dr. Benatti and Dr. Fowler in Pittsburgh, because they understand me, and I can be really honest with them and open. And that's what you need to be able to do. Sometimes we may have a disagreement on which path to go down, but ultimately as the customer, I get to decide, but I want them to know everything that I do so they become more knowledgeable and they may be able to help other people in different situations.
And I want to compliment you on that, because from the very beginning of our discussions, this is pre-surgery, this is pre-doctor, pre-provocative test that you and I have been talking. And from the beginning, you said, I want to be able to get to the doctor's situation post-surgery and share my story. What a compliment to you, to just that service to others, to say, I'm here because I want to make sure that we document this to some degree all the way through. And we've been in conversations literally every step of your journey, which I really applaud you for that. I think that's just a wonderful way to help others. And to the point of this, the cardiology team, the people that you're talking to back home, not at UPMC, University of Pennsylvania Medical Center,
University of Pittsburgh.
Pittsburgh. Um, to the point that you're now educating people in your very own community in the cardiology space to something that they were unaware of. Some of
Mhm.
us do have bypasses with the
Right,
with the condition, but it is not a bypass by any means, in no way,
right.
shape, or form. And so now they're educated. So maybe they will see the symptom come through with a person and go, "Oh, let's take a look and see if it might be a bridge," now that we understand it a little bit differently. So to everybody that has the condition who gets treated and has the ability to share to make sure another person in the medical community is aware, that's one more person that might pick up the symptom in a patient to save that patient all the grief
Mhm.
have to try to get this thing diagnosed properly. So
Yeah, and I've shared with the local team here too, is all the doctors and nurses I talk to, I'm like, "If someone needs their bridge unroofed, you gotta go to Pittsburgh."
Mhm.
Just because it's so local for us and our insurances work in state, all of those type of things too. So even them knowing just there's an expert that's, 5 hours away or 4 hours away, it's a lot better than saying, "I don't know what to do with you."
Right.
That's kind of the whole point of this whole thing too. And go ahead.
Hey, I say I wanna take just a short step back. You're obviously a high energy guy. You're a get it done guy. You move, 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 move until you find a solution. You're looking for all of that. For the benefit of the others who are listening, yeah, they may not quite be in that same space, but somebody's got a bridge. Maybe they've just been diagnosed. What would you say to them? What would you say about the next steps in the process?
Definitely talk to as many doctors as you can. Everybody does Zoom calls now. You don't have to go to the office. That's how I was able to, talk to 13 different surgeons and then narrow it down because you can do that relatively quickly. And usually, they'll charge you, $65 for a visit, and you can really find out quickly. Like I talked to Dr. Kofidis, Dr. Guy, Dr. Henry, Dr. Benatti, all in 2 weeks.
Mhm.
Like I scheduled all of those meetings. They were bouncing around between each other, but it got me where I was like, okay, I like this, I don't like this, I like this, and this. Oh wait, now I can ask a new question. So it's really about advocating for yourself and listening to literally all of these podcasts, because I educated myself in the fact that then I could go to the internet and research different things associated with bridges after I learned the language, the doctor's names, the protocols, all of those type of things. And your website has a lot of the resources that you need. Just don't give up. Don't wait for your doctor to say, "Oh, go over here." Like all of these doctors, I referred myself to them, every one of them.
Mm.
I didn't need a referral for anyone. I just called their office and said, "I want to be unroofed." And they're like, "Oh, okay." We'll get you in the system. So, it's a lot easier than what most people think, because I thought I was going to have a harder time than that. But everyone called me back because every one of the hospitals are looking for more business. But you just go in and say, I want this done. Not necessarily you're going to have it done, but you say, "I want this," and they will set up the appointments and get you in.
And I think that's the big thing for anybody to know that you are in control of the situation. Once you've been diagnosed, it's in your hands. To the extent of insurance, we certainly understand that as well. But we've even got a gentleman who couldn't get his insurance to get him to where he needed to go, so he went and found a cardiologist in his backyard where he did all the homework for the cardiologist. Certainly, they were familiar with bypasses and other
Mhm.
heart surgeries, and this is not a complex heart surgery per se, But if you
Right.
don't know it, you don't know it. And so he shared everything he could find with those surgeons and had his unroofing procedure done. It was the first one they had done. And so far, so good. We'll have a follow up with that's Pete Furman.
Yeah.
Once he's completely clear and we know how well he's doing. But so far, so good. You know,
And one of the things I would say, and you and I can both talk to this, I would suggest highly if you can get a minimally invasive surgery versus a full sternotomy, like do it. I don't know, you could speak to where you were at in 2 months after your full sternotomy versus me. Maybe you can add some information on that, but it seems like it's a lot less intensive than that full sternotomy.
yeah, if you're a candidate, if you are a candidate for robotic surgery, and the surgeons will tell you, not everybody can be. In my case, I wasn't. I needed a bypass and
Right.
some other stuff going on. But if you're a candidate, by all means, seriously consider it. It's just another option for you. And some people are perfectly comfortable with the sternotomy to say, I want him to go in and knowing that he can see everything and she, whoever the surgeon is, that it's all right there for them and it's presented. And if you're comfortable with that, that's fine. It's a little bit longer process. The robotic surgery, to your point, it is not painless. And I think people think, oh, this is a piece of cake. It's a whole lot easier. And we're still
Yeah.
talking about heart surgery, number one, but it's not painless. And a thoracotomy is not painless. Anytime you're poking through muscle, you're going to have situations that create pain.
Right.
But it's in most cases much less. And again, where it's an option, by all means, it gets you back to work, it gets you back to doing the things you did a whole lot sooner. And there are different complications that come from the robotic and or more minimally invasive than we see necessarily in sternotomy and vice versa. Sternotomy has some complications that could occur that you won't necessarily see robotically. But either way, just keep moving forward. Don't give up. I know you're going to cycle in and out if you're somebody who's in the space still trying to figure out what the best thing to do is, but just keep moving forward. Even if you have a couple of setbacks, even if you get a couple of significant denials, just keep moving forward and know that while some surgeons do the surgery without a provocative test, that if that's an option for you, if you can get that information, all that information is just more support for the surgeon who's going to do the work and actually unroof the bridge. So the provocative test is an important part. And like I said earlier, thanks to you, David, because of your insistence. I mean, I remember you calling me after you met with both Dr. Fowler and Dr. Bernardi. You said, I talked to them about the podcast. They're going to do it. They want to do it. They're really interested in
Yeah.
participating. And you were actually pushing them. Uh,
Yeah.
and now they are interested in being one of the foremost centers as well, centers of excellence that can provide both the full provocative testing as well as the surgery robotically for unroofing. And we're going to see
Yeah.
them doing more and more. And this is because of you.
Well, and when I saw the capabilities of the UPMC Presbyterian in Pittsburgh, it's one of the most state of the art facilities in the country. And coming back to get the provocative tests. Like I would not have been unroofed if they would have came back and said that provocative test was negative. Like because there's no way I would want to go through this if that is not what's causing my symptoms. We knew 100% that my bridge was causing all of my symptoms and my chest pain for my entire life. So I would highly advise everyone, yes, it's an extra procedure, but it's usually you go in the morning and you're going home in the afternoon. Your arm's a little sore if they go in your arm, or your groin will be a little sore where they go in. But that short amount of pain will make you certain that you're making the right decision. I mean, I had all of this evidence, and I remember texting you and saying, Jeff, like, is this really the right decision? Because it's really scary because it brought in perspective. Like my wife was like, what happens if you die on the table? What's going to happen to the kids and what's going to happen to me and like all of these things. So it really makes you think because it's a bigger deal than just saying, oh, I'm going to go get a minimal invasive heart surgery.
Right.
You know,
Yeah. And I'll add one thing to the best of my knowledge at this point in time, and we're talking in November of 2024, to the best of my knowledge, nobody has ever died on the table,
Right.
which is really great to hear.
Yes.
Everybody's come through it. And it's not the surgery. So don't fear the surgery as much. Don't fear that sternotomy. Don't fear getting, something done to the extent that some people do. Don't let it paralyze you.
Right.
It's there.
Yeah. It's an emotional roller coaster.
Well, and I was just gonna touch on that. You just took the words out of my mouth. I would say, give us just a little bit. We're at the end of your process, and we wanna, wrap up about here too, but the emotional state. Give me a little bit of your, ebb and flow and where you are today now that you're complete.
Yeah. So, prior to surgery, a lot of anxiety, like thinking, but it was more of an excitement anxiety because what helped me through the process was calling you and then making a commitment to you, like, hey, I want to do the podcast. So now I had to commit to myself that I was going to go through the entire process. And then when I got my doctors involved, now that's an extra push. I can't back out now because I got them involved. They're excited to do the podcast, which can help a lot of people. So, that's what helped push me to hold me more accountable, pre-surgery, because there's a lot of emotion pre-surgery. Like when you have a date, it's scary because that's one of the biggest surgeries I've ever had in my life. And, knowing that there's going to be a recovery period, knowing all of these other things, you know, dealing with the AFib on top of the recovery was a lot harder emotionally because I was expecting to be back to the gym at 30 days post-op. I was expecting to be back, doing work and doing these other things. Fortunately, I'm a serial entrepreneur and I have a big team that helps me, but still it really got to me just sitting on the couch and just walking around the house. And there was 2 days that, one day I just started crying,
Mhm.
and it was like, how do I get out of this? Because the AFib and the side where I wasn't able to do what I needed to do, to make me feel better, it just got to me. But then I was like, okay, tomorrow's going to be a new day. I'm going to go to bed tonight, get up tomorrow and keep driving forward and then keep searching. If you're looking for answers, there's always going to be answers out there, but you got to keep digging. You got to be persistent. And, fortunately for me, my wife tells me I'm the most tenacious person she's ever met. But you have to use some tenacity to keep driving yourself forward because it will get better every day. You're going to have ups and downs, but looking back, if you would have asked me 2 weeks ago, are you certain you would do this again? I would be like, man, I don't know. But now that I'm finally feeling like me, like this morning I woke up, my heart rate was 58, 59. That was what it
Congratulations.
was pre-surgery, and that's with no drugs, on that. So that's really exciting for me. Like, okay, I'm getting back to where I was, you know, or pre-op, and now I'm going to be in better shape. Now I'm going to be able to do more as things go forward. So it's just keeping that mindset and using like Jeff or your doctors to hold you accountable because you make them a promise that you want to do something. You got to go through with it.
It's like stating that goal. You tell somebody. The more people you tell, the more likely you are to hold on to it.
Right. Yeah.
So I will share one more thing, and then we'll get into a wrap that I want to have you mention one other thing that you're doing. You are the only person who, days before you're going into surgery, calls me as if you're going to the Super Bowl tomorrow. With the enthusiasm and excitement of, "I can't wait. I'm going in. Dr. Benai's gonna da 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 da." And I have to laugh because I think it's that positivity and it's that energy and not letting the negativity set in to where we're going through with this. It's gonna be a good thing, and while I may have some challenges and my trend line may not be straight up, when I come out of this, for the most part, I should be better. And the majority of people who have gone through the process end up in a better place than they were prior. So, I appreciate it. I appreciate your enthusiasm because it motivates me to do what we do too. And
Yeah.
I want to share that as a result of your journey, both your wife's and your journey, hers with her cancer, yours with your myocardial bridge, you now have a program, a website, and a podcast that you're going to do called The Vollmer Journey. You
Yes.
wanna tell us just a quick little bit about that?
Yeah, it's just I'm putting together episodes. We did one episode so far just on my wife's, you know, cancer, and it was back in March, and then I kind of been putting it off because of my journey and hers. We got too much stuff going on. But now what I'm going to do is I'm going to talk about everything that we did specifically for her cancer, how we did it all unconventional. All she had a surgery and no chemo, no radiation, no immune therapy, everything with naturopathic approaches and with scientifically backed approaches that aren't used in mainstream. And same with myself. Everything that I did for my bridge, for my AFib, is all scientifically documented in PubMed, in the NIH, in other journals, but it's not used by mainstream. So I want to just bring those options up and show people there's a lot of alternatives out there that can allow you to get to your goal without pharmaceuticals. And if you have bad reactions to pharmaceuticals, there's different ways that you can do this. And it even coming down to the diet, we're going to talk about how we do everything. So what my podcast is going to be is about.
I want to remind everybody that, again, if you don't subscribe to the podcast, do, because post this episode, the very next week, we're going to have Dr. Fowler, who is going to talk to us about the provocative tests, what this invasive catheterization is, all the details of it. You mentioned a couple of the chemicals. He'll explain it. He'll explain why we do it, how we do it, and what the purpose of it is. And then following that, we're going to speak with Dr. Bonatti, your robotic surgeon, and it'll be specific to your case to where people can say, okay, now I understand. I heard from that guy, and now I'm going to hear from his doctor. And I think it's just going to be, one of the first times we've had the sequence of patient to process to surgery of all three of the people that were on that team. So I'm really excited about it. I can't thank you enough, Dave, for putting this together, because you're the one that did this all the way through. You said, I want to be able to share this. I want to make sure the doctors understand it. I want the doctors to be able to share it. And you held them accountable to say yes. When you went in there
Yeah.
and said, if I'm going to do this, I want you to come on the podcast. You have to share this because everybody needs to hear it. And it's just so refreshing to see the interest and the enthusiasm and the energy post surgery now as you're healing. You're still, it's a 12-week process, really.
Mhm.
You're 2 months into it, and I'm thrilled to hear how you're doing and the fact that you've got this AFib under control, which is not an unusual situation post surgery. All kinds of things can happen because it's heart surgery. But
Right.
I just so appreciate you and what you're doing for all of us as well. And I will put all the information on your journey program in the show notes so people can just grab the link and get to you.
Yeah. Yeah. And if anybody wants to get a hold of me, they can it's David at thevollmerjourney.com. And I'm sure you'll post that out
I
there.
will.
And one of the benefits with Dr. Bonatti and Dr. Fowler is they're going to present all of my info. Like, and I did hold them accountable for that because I told them prior to doing it, like, hey, we want to do this on the podcast. And, when Dr. Fowler, that's why he did such detailed notes. And he's going to show everybody exactly what went on and how the measurements were, how the flow was, all these things. And then Dr. Bonatti, I remember him waking me up in the ICU and saying, David, your heart looks so good. And I got everything on film, So that was exciting to me because he was so excited that they recorded everything, knowing that they were going to bring it out and present it to people and show people so you can really get the detail, where most of the time they don't. It's always in hindsight. You want to go back and you may have not have done something because you didn't think about it because it wasn't going to be used in the future.
Yeah, it's not many patients that say, I want you to see everything that happened to me. So
Yeah.
it'll be, I've seen both Dr. Fowler's pieces that he's going to share. They're incredible. And I've seen the snippet that Dr. Bonatti is going to talk about, which is incredible. And it's not as gross and gory as some people think when they, uh, you know, show us a heart surgery. It's actually, from my perspective, it's nice to be able to see it because you can then mentally see what's happening to you. And when you go into your surgery, you can visualize how to heal yourself. And I don't mean literally, but visualization And that thought process is a holistic way to help your body heal. So I can't wait for the next couple of episodes. I was so excited to get to this one with you today. I know it's been almost a year in coming, and here we are starting from symptomatic to post unroofing procedure, and then now the storytelling along the way that's going to bring it all together for the next couple of episodes. David, thank you so much. I appreciate you. I appreciate your time and everything you're doing.
No, I really appreciate you and the whole community. I mean, the Facebook page, I'm in there commenting a lot, and a lot of people bring a lot of great ideas and thoughts and their stories to that. So that's what helps everybody through this. Because if it wouldn't have been for you, the group and the website, I would have known nothing, and I wouldn't have known how to fix this. So I really appreciate everything that you guys have put together here. It's really great.
Looking forward to the next episode. Thank you for listening to Imperfect Heart. It's my hope that this information helped in some way to improve your situation or will help you better understand this condition. More importantly, that it gives you hope through stories that there is help and you most certainly are not alone. If you've been diagnosed with a myocardial bridge, please be sure to join the private Facebook group, Myocardial Bridge Support Group. For more information about our program or to reach me directly, visit the website, myimperfectheart.com. If you like what you heard today, please give a positive review, thumbs up, high five, or whatever your app likes. And be sure to share with everyone important to you so they understand what it is you're dealing with. Please subscribe as well. Welcome each day with gratitude and positivity. The views and opinions expressed in this program are solely those of the host and the guest and are not intended to provide, nor are they a suitable substitute for, professional care by a doctor, therapist, mental health professional, or other qualified medical professional. Imperfect Heart is a production of Hear Me Now Studio.